How is esophagitis diagnosed with endoscopy? Imagine having a tiny camera on a flexible tube that can see inside your throat and esophagus. That's what an endoscopy does when doctors look for esophagitis. Esophagitis is inflammation of the esophagus, often caused by acid reflux or gastroesophageal reflux disease. To find out if you have it, a doctor will perform an endoscopy. During the procedure, a healthcare provider gently inserts a long, thin, flexible tube called an endoscope through your mouth and down your throat. The endoscope has a small camera attached to its tip, which sends real-time images to a monitor. This allows the doctor to see the lining of your esophagus, stomach, and the start of your small intestine. They look for signs of inflammation, redness, swelling, or even small ulcers that indicate esophagitis. Most of the time, the procedure is done with mild sedation, so you feel relaxed. A numbing spray is often used to reduce throat discomfort. As the tube passes down, you might be asked to swallow to help the endoscope move smoothly. The doctor carefully examines the esophageal lining for any abnormalities. If they see redness or erosions, these are signs of inflammation caused by acid reflux. In addition to visual inspection, the doctor may take tiny tissue samples called biopsies from the esophagus. These samples are examined under a microscope to confirm inflammation and to identify the cause. For example, biopsies can reveal if the inflammation is due to acid reflux, medication injury, or immune-related conditions like eosinophilic esophagitis. The endoscopy helps doctors determine how severe the esophagitis is and whether there are any complications. It can also rule out other issues like Barrett's esophagus, which is a change in the esophageal lining that can lead to cancer. The whole procedure usually takes about 15 to 30 minutes, and recovery from sedation typically takes around 20 minutes. So, in simple terms, doctors diagnose esophagitis with an endoscopy by inserting a tiny camera into your esophagus, looking for signs of inflammation, taking tissue samples for microscopic analysis, and assessing how much damage has occurred. This process helps guide the right treatment to ease symptoms and prevent further problems.